Hello, I'm Dr. Erik Sims. I'm a board-certified podiatrist in foot surgery and a certified wound specialist. I've been practicing here at Sims Associates Podiatry for over 10 years. I became a podiatrist for many reasons. Obviously, being able to work with my father was a huge factor, but just as important, being able to help people in our community on a daily basis is what it's really all about. There are many areas of podiatry that interest me and I specialize in. First and foremost, sports medicine, being able to treat anyone from a high-level college Division I athlete to just someone trying to train for a 5K or a weekend warrior. So I take pride in getting people either back on the court or in their sport, or being able to do what they do on a daily basis. Another huge area is diabetic wound care and what we consider limb salvage. As short as 10 years ago, many of these individuals would just go on to an amputation. And nowadays, with new technologies and new techniques, we're able to save a lot of limbs. And so we're keeping people mobile, we're healing their wounds, but we're preventing amputations on a regular basis. And then the other thing I really enjoy is what we'd consider quick fixes. So that would be someone who comes in with tremendous amount of pain, and that can be from gout or an ingrown nail. And literally within a few minutes as they walk to the front desk on the way out, they're feeling dramatically better. And that's a rewarding thing as well. One of the ways I get to connect with patients is to get to know them as individuals. So there's a big push in medicine towards protocols. And while we certainly believe protocols and evidence-based medicine has its role, we believe in tailoring a treatment plan towards the individual. So, for example, if physical therapy is what the protocol says for a certain condition that we treat, but yet I know, since I've gotten to know that patient, that they commute to the city, and then when they get home, it's 8 o'clock here at night, and every physical therapy place is closed by then. That may not be the best treatment option for that patient. And so we'll work with them to develop a different kind of approach to get them better. Similarly, if we have a self-employed contractor who probably would benefit from surgery, or the most definitive approach would be surgery, but yeah, I know, or they tell me, that there's absolutely no way they can take 2 months off to recover from surgery, then we'll work with them to get them better in a different approach or a different way. So I think gone are the days where we, as doctors, just dictate care. It's more of a collaborative approach to come up with something that works for the patient and their lifestyle as well as their condition. I feel the success we've had here at Sims Associates Podiatry stems from the way we treat people. So our staff is warm and welcoming, and that's really comes from the culture my father developed many years ago, the way he built this practice. So it was always about the patient first and foremost, and yet as we continue to evolve, we bring on new techniques and new technologies to allow for the best patient's results as well. And so the combination of those two provides the best experience for the patients. So as we continue to grow and as we continue to commit to getting better, this has allowed us to actually train our future residents here in the Hudson Valley in podiatry, and that's really exciting as well. What I love about practicing here in the Hudson Valley is being a part of the community and seeing my patients out and about. My family and I often bump into our patients in restaurants and stores and the mall, and we love that part. I'll tell you a funny story. Recently I was out with my son. He was probably 6 years old at the time, and we bump into one of my patients, and I'm chit-chatting for a little bit, and as I walk away, Alex says to me, "Daddy, it's like you're friends with your patients." And I had a big smile on my face, and I just kind of looked at him and said, "Yeah, we kind of are friends with our patients." I really think that's the way it should be. That's kind of what I love about what I do. I think what you'll find here at Sims Associates Podiatry is that we go above and beyond. It's not just about treating someone's foot pain. I'll sort of give you an example. Someone came in recently and they had a foot problem that we were treating, but during that encounter they had mentioned they were going through a whole slew of tests and being worked up for pancreatic cancer. And they just had a biopsy in the last several days, and they would find out the results soon. So several days later I called him on the phone, and fortunately the biopsy results were negative. He did not have pancreatic cancer. But he was sort of blown away that I had taken the time to call him and see. And I don't know, I just think that's kind of natural. That's kind of being a caring individual, or a caring human being. It's not just about their foot pain, it's about caring for individual patients and individuals.